Good afternoon, everyone. Thank you for joining us. Today, we're going to talk about a very important topic, periodontitis, or advanced gum disease. Many of you might be familiar with deep cleanings and antibiotics, and you might wonder why sometimes, those aren't quite enough to fully resolve the problem. This presentation aims to empower you with a deeper understanding of your treatment options. We'll cover everything from the role of various medications, what to watch for with at-home treatments like Periorestore, why surgery might become necessary, what to expect during surgical procedures, and other emerging approaches for both bone loss and bad breath. Our goal is to ensure you feel informed and confident in making decisions about your oral health journey. Before we dive into treatments, let's quickly review what periodontitis is. It's a progressive form of gum disease. It starts as gingivitis, which is inflammation of the gums, often noticed by bleeding when you brush or floss. If left untreated, it can advance to periodontitis, where the infection spreads below the gum line, attacking the bone and ligaments that support your teeth. While bacteria are the initial trigger, a significant amount of the damage, particularly bone loss, comes from your body's own immune system overreacting to the infection. Key signs you might notice include persistent bleeding, swollen or tender gums, chronic bad breath, gums pulling away, recession, and in later stages, teeth becoming loose. Without proper management, periodontitis is a major cause of adult tooth loss and has been linked to other systemic health issues like heart disease and diabetes. For many patients, the first and most crucial step in treating periodontitis is what we call deep cleaning, or scaling and root planing, often abbreviated as SRP. This isn't just a regular cleaning. It's a professional procedure where we meticulously remove bacterial plaque and hardened tartar, known as calculus, from both above and, critically, below your gum line. Scaling is the process of removing these deposits, while root planing involves smoothing the tooth root surfaces. This smoothing is vital because it makes it harder for bacteria to stick and reform plaque. The primary goals are to eliminate the source of infection, reduce inflammation, encourage your gums to reattach more firmly to your teeth, and generally create a much healthier environment in your mouth. For many cases, especially mild to moderate periodontitis, this non-surgical approach, combined with excellent home care, is all that's needed to stabilize the disease. While deep cleaning is the foundation, antibiotics can be a very valuable tool. However, it's crucial to understand their role. They are an adjunct, meaning they supplement our mechanical cleaning, they don't replace it. We have two main types. First, local or topical antibiotics. These are placed directly into a deep gum pocket after cleaning. Examples include products like Arestin, Atrodox, or Periochip. The advantage here is a high concentration of the medication precisely where the infection is, with minimal impact on the rest of your body. Second, systemic or oral antibiotics. These are pills you take by mouth, like doxycycline or metronidazole. They're typically used for more widespread or aggressive forms of the disease. However, antibiotics have significant limitations. The bacteria causing periodontitis live in protective communities called biofilms, essentially, the plaque and tartar that build up. These biofilms are incredibly resistant to antibiotics, far more than free-floating bacteria. Crucially, antibiotics cannot physically remove hardened tartar or reshape the damaged bone. As long as these physical hiding spots remain, bacteria will quickly return. So, remember, antibiotics help, but they are always used in conjunction with deep cleaning to target the bacteria and help your body heal. Beyond prescription antibiotics, there's a growing array of non-antibiotic antimicrobials, many for at-home use, which offer a flexible way to manage bacteria daily. A notable example is Periorestore, which uses a 1.7% hydrogen peroxide gel. Hydrogen peroxide is a powerful germ killer that releases oxygen to target the bacteria, especially those causing bad breath. What makes Periorestore unique is its use with boil and bite, moldable trays. These trays allow the gel to stay in direct, prolonged contact with your gums and access the gum line and shallower pockets more effectively than a simple rinse. It's a non-antibiotic option, which is great because it doesn't contribute to antibiotic resistance, and it's excellent for daily bacterial control and fresh breath. However, it's important to understand that while these trays help with penetration, they are not as precise or designed for deep pocket sealing as the custom-fitted trays used in professional methods like PerioProtect. Other over-the-counter mouthwashes, containing ingredients like essential oils or CPC, are also effective for reducing surface plaque and gingivitis. And, of course, simple saltwater rinses offer mild antiseptic benefits. Always discuss any natural or home remedies with your dentist, especially concentrated herbal extracts. The key takeaway here is that Periorestore, with its tray system, offers a distinct advantage for targeted at-home bacterial control compared to simple rinses, but it's always an excellent adjunct to your professional dental care, not a replacement for comprehensive treatment in advanced cases. If you choose to incorporate at-home non-invasive treatments like Periorestore, your vigilance and consistency are paramount. First, you must use these products exactly as directed, every single day, to see benefits. They don't replace your fundamental daily oral hygiene, so continue to brush thoroughly, floss diligently, and clean your tongue. Most importantly, you need to watch for red flags, signs that your at-home efforts might not be enough and the disease is progressing. These include persistent or increasing gum bleeding, swelling, or tenderness, worsening bad breath or an unpleasant taste, new or increasing gum recession or tooth sensitivity, any new tooth looseness or shifting, or the presence of pus from your gums or a dental abscess. These are all serious signs that require immediate professional attention. This brings us to our final crucial point on this slide: regular professional monitoring. Even with the best at-home care, only your dental team can truly assess the effectiveness of your treatment. We measure pocket depths, take X-rays to check bone levels, and identify any hidden issues. This ongoing partnership between your home care and our professional evaluation is what ensures long-term periodontal health. So, if deep cleaning and antibiotics are so good, why aren't they always enough? For areas with significant bone loss and deep periodontal pockets, typically 5 mm or more, relying solely on repeated deep cleanings often falls short of achieving long-term stability. Here's why. First, there are accessibility limits. Even with the most skilled hands and specialized instruments, it's incredibly challenging, and often impossible, to thoroughly clean the very bottom of extremely deep pockets. Second, advanced periodontitis creates irregular bone defects, like craters in the bone around the tooth, or involvement of the furcations, the areas where the roots of molars diverge. These anatomical irregularities become perfect, bacterial traps that are physically inaccessible to our instruments during a non-surgical cleaning. As long as these physical hiding spots remain, even if antibiotics temporarily reduce bacteria, the harmful biofilm will quickly recolonize. This means the inflammatory cycle and bone loss will continue. Fundamentally, periodontitis, at its core, creates structural damage to the bone. While non-surgical methods address the infection, they generally cannot reshape these bone defects or significantly reduce these deep pockets in areas where the bone has been severely compromised. For these persistent structural problems, we often need a structural solution. Because of these limitations, periodontal care follows a very logical, staged approach. We always begin with Stage 1, initial non-surgical therapy. This is your foundational treatment, the deep cleaning, your excellent home care, and sometimes the use of local or systemic antimicrobials. After a period of healing, typically 4 to 8 weeks, we move to Stage 2, reevaluation. During this visit, we meticulously re-examine your gums, measure pocket depths again, and assess how well the tissues have responded. In many areas, we'll see significant improvement, and those areas can then be managed with ongoing regular maintenance cleanings. However, for those specific areas where deep pockets, typically still 5 mm or more, stubbornly persist despite thorough non-surgical treatment, it tells us there's an underlying anatomical issue that non-surgical methods simply cannot resolve. This is when we consider Stage 3, targeted surgical intervention. Procedures like osseous surgery or regenerative techniques are designed to access, clean, and reshape these difficult areas, creating an environment that can finally be cleaned and maintained effectively. It's a precise, targeted approach for areas that truly need it. Let's talk specifically about osseous surgery, as it's a common surgical recommendation for persistent deep pockets. The name osseous refers to bone, as this procedure involves reshaping the bone around your teeth. It's performed by gently lifting the gum tissue, much like lifting a curtain, to gain direct access to the underlying tooth roots and the bone around them. This allows us to meticulously clean all remaining plaque and tartar from the root surfaces that were inaccessible before. Crucially, we then carefully reshape any irregular bone defects that were acting as bacterial traps, smoothing them out to eliminate those deep pockets. Finally, the gum tissue is carefully repositioned and secured with tiny sutures to hold it snugly against the newly contoured bone and clean tooth. You might wonder about gum healing and reattachment. Your gum tissue has a remarkable natural ability to heal. While initial healing occurs quickly, often within days to a few weeks, the full strengthening and maturation of this new gum attachment can take several months. Factors that greatly influence successful reattachment include how thoroughly the area was cleaned during surgery, your diligent home care post-surgery, whether you smoke, as smoking significantly impairs healing, your overall systemic health, especially if you have conditions like diabetes, and, of course, the precision of the surgical technique. While perfect biological reattachment isn't always guaranteed, the goal is always a strong, healthy, and stable attachment that drastically reduces pocket depths and creates a cleansable environment. We understand that the idea of any surgery can be unsettling, so let's walk through what to expect during and after osseous surgery. During the procedure, your comfort is our priority. The area being treated will be completely numb thanks to local anesthesia. For those who experience dental anxiety, we often have sedation options available, such as nitrous oxide or oral conscious sedation, to help you relax. The length of the procedure varies depending on how many areas are treated, but it can range from 1 to several hours. After the procedure. During the recovery period, it's normal to experience some mild to moderate discomfort, swelling, and possibly minor bleeding for the first few days. We'll provide detailed post-operative instructions and pain medication to manage this, and applying an ice pack to your face can significantly reduce swelling. We'll recommend a soft diet for a few days to a week. For oral hygiene, you'll be instructed to avoid direct brushing or flossing on the surgical site initially, using prescribed antimicrobial mouth rinses instead, while continuing to clean other areas normally. You should limit strenuous physical activity for the first few days. You'll also have important follow-up appointments within a week or two for us to check on your healing and remove any stitches. It's common to experience temporary tooth sensitivity, especially to cold, but this typically diminishes over several weeks to months. Following all post-op instructions carefully is crucial for optimal healing. It's absolutely valid to be concerned about how your smile might look after osseous surgery. It's important to understand that this procedure, while highly effective functionally, does cause aesthetic changes, primarily in the form of gum recession. This isn't a failure of the surgery, rather, it's a direct and often intended consequence of achieving optimal gum health. Because the goal is to reduce those deep, unhealthy pockets by reshaping the underlying bone to a shallower, maintainable level, your gum line will almost always settle lower. This means more of the tooth root surface becomes visible, and your teeth will appear longer. The amount of recession is generally predictable and proportional to how much bone was lost to the disease in the first place. You might also notice black triangles, small, dark spaces between your teeth near the gum line, becoming more pronounced. This happens if significant bone and gum tissue were already lost due to the disease in those areas. Again, this is an unavoidable consequence of treating advanced disease and creating a truly healthy, cleansable environment. The key takeaway here is open communication with your periodontist. We will discuss the expected aesthetic changes specific to your case before surgery to help set realistic expectations and ensure the treatment aligns with both your functional health needs and your aesthetic preferences. The goal of osseous surgery is to create a maintainable environment for your oral health, and when done appropriately and followed by dedicated care, it has a high success rate in achieving its primary goals. We consistently see significant and sustained reductions in periodontal pocket depths, often bringing them down to a healthy, manageable level. It's highly effective in halting the progression of bone loss and inflammation. Perhaps most importantly, osseous surgery plays a critical role in preserving your natural teeth that would otherwise be at high risk for extraction due to advanced periodontal disease. By creating a stable, cleansable environment, it provides a strong foundation for your teeth for many years. While individual results can vary, success rates often exceed 85% in terms of maintaining treated teeth over the long term. It's vital to remember that while the surgery effectively manages the disease and creates a healthy environment, it doesn't cure periodontitis outright. Periodontal disease is a chronic condition that requires ongoing vigilance. The long-term success of the surgery is strongly dependent on two factors: your commitment to excellent daily oral hygiene at home, and your adherence to the recommended schedule of professional periodontal maintenance appointments, often every 3 to 4 months. This ongoing partnership is the true key to long-term success. Beyond osseous surgery, the field of periodontology offers other advanced approaches, particularly for bone loss, that you might hear about. First, there are regenerative procedures, such as guided tissue regeneration, GTR, and guided bone regeneration, GBR. Unlike osseous surgery, which reshapes existing bone, these procedures aim to actually rebuild the bone and other supporting tissues that have been lost due to disease. This often involves placing a special membrane over the bone defect, sometimes with bone grafting materials or even growth factors derived from your own blood, to encourage your body's natural healing processes to regenerate new tissue. This can be a game changer for saving teeth that might otherwise be lost. Second, we have host modulation therapy, or HMT. This approach focuses on altering your body's inflammatory response to the bacterial infection. Remember, much of the damage in periodontitis comes from your body overreacting. Low-dose doxycycline, for example, is sometimes used not as an antibiotic, but to inhibit destructive enzymes in your tissues, reducing inflammation. Third, probiotics for oral health are gaining interest. Similar to gut probiotics, these introduce beneficial bacteria into your mouth to help rebalance the oral microbiome, outcompeting harmful bacteria. They can be helpful as an adjunct for managing gingivitis and mild periodontitis, and can also contribute to reducing bad breath. Finally, ozone therapy is another emerging area. This involves using ozone gas or ozonated water, which has powerful antimicrobial properties, directly in the gums or pockets to kill bacteria and promote healing. While it shows promise as an adjunct, we're still waiting on more extensive research to fully establish its long-term efficacy as a primary treatment for advanced periodontitis. While we've focused heavily on gum disease, it's important to know that bad breath, or halitosis, can stem from various sources, not just periodontitis. The most common causes are oral. The back of your tongue is a significant reservoir for odor-producing bacteria, so regular tongue scraping or brushing is highly effective. Dry mouth, or xerostomia, also plays a big role because less saliva means less natural cleansing of your mouth. This can be caused by medications, certain medical conditions, or mouth breathing. And, of course, generally poor oral hygiene allows plaque and food debris to build up and produce odors. However, Bad breath can also come from non-oral causes. Certain foods like garlic and onions can produce sulfur compounds that are absorbed into your bloodstream and then exhaled. We also see halitosis linked to various systemic health conditions, things like sinus infections or post-nasal drip from your respiratory tract, metabolic conditions like uncontrolled diabetes, which can cause a fruity breath, or even kidney or liver failure which produce distinct odors. Gastrointestinal issues like GERD, or acid reflux, can also lead to bad breath. Finally, tonsil stones, small calcifications that form in the tonsils, can trap bacteria and cause a foul odor. If your bad breath persists despite excellent oral hygiene and gum disease treatment, it's crucial to consult with your dentist or doctor to identify and address any underlying causes. When it comes to your periodontitis treatment, remember that it's a very personalized journey. Your dental professional will assess your unique condition and present the best options for you. This is where open communication is vital. Don't hesitate to ask questions, discuss your concerns, and explore the benefits and risks of all recommended approaches. While the idea of surgery can be daunting, it's important to view it as a highly targeted solution for specific areas that genuinely require it to achieve lasting health. For those advanced areas with deep pockets and significant bone loss, solely relying on repeated deep cleanings or occasional antimicrobials may not be enough to completely halt the progression or prevent future tooth loss. Ultimately, our shared goal is to achieve stable, maintainable periodontal health. This not only protects your teeth but also improves your quality of life and supports your overall systemic well-being for many years to come. Your role in this partnership, through diligent home care and consistent professional maintenance appointments, is absolutely critical for the long-term success of any treatment you undertake. In conclusion, periodontitis is a complex, chronic condition, but with the right approach, it is absolutely manageable. Remember that treatment often follows a staged approach, starting with non-surgical methods as the foundation and progressing to more advanced options, including surgical procedures like osseous surgery or regenerative techniques, when persistent issues like deep pockets or bone loss demand them. We have a wide range of therapies available today, from deep cleaning and various antimicrobial medications, both prescription and at-home options like PerioRestore, to advanced surgical and regenerative procedures. The key takeaway is this: successful management hinges on a strong partnership between you and your dental team. It's about your diligent home care combined with our consistent professional evaluation, tailored treatment, and regular monitoring. By understanding the full spectrum of available options and engaging openly with your dental professional, you are empowered to make informed decisions that protect your oral health and contribute to your overall well-being for years to come. Thank you.